Kia ora, my name's Nick Wilson. So this blog's been running for 7 years now, since 2013. It's widely used actually. We found journalists pick up on it, politicians, and actually several hundred health workers around New Zealand and some internationally regularly subscribe to the blog. Many of the blogs have ended up as media articles. The media pick up on them and run stories. And the current editors and production team include myself, Cristina Cleghorn, Richard Edwards and Lani Teddy. So one of the big advantages of this blog is that not only does it reach those who subscribe to the blog, but it's also automatically syndicated to SciBlogs, the top science blogging site in New Zealand. A key point of difference with this blog is that it really is a scholarly blog, and it tries to present public health and scientific evidence and logical arguments in the whole domain of public health. The topics cover a very wide range. They've been a bit dominated by COVID-19 recently, but we often cover issues around tobacco and vaping, health economics, alcohol, nutrition, and environmental health. So we invite you to contribute to the blog. In fact, if you're a public health practitioner or a university researcher throughout New Zealand, we invite submissions. And also if you're a graduate student doing public health courses and writing for the blog is part of your classwork. It's fine to submit a full piece of work, but really we advise you to contact one of us editors to discuss if it's going to be a good fit. So in terms of blog length and structure, blogs should be under 1,000 words and have 2 or 3 sentences as a summary at the start. If there's additional material that's critical, we can often put that into an appendix. Ideally, blogs should be referenced because of that scholarly feature we're trying to get with the blogs, but you can also use hyperlinks to link through to supporting evidence. If you have a photo you took that could go nicely with your blog, please provide it. Otherwise, we can usually find a suitable copyright-free photo and add that in the publication process. Submitted blogs will have a peer review process either by one of the editorial team, or we will select a reviewer that will help with that peer review process if one of the editorial team are somewhat unfamiliar with the topic. The editorial process typically results in some refinements and improvements, often to keep the blog within the typical public health blog style. And a majority of submitted blogs get published within 1 or 2 weeks of submission. After publication, you should check out the version that was automatically syndicated to SciBlogs, because sometimes readers at SciBlogs comment on your piece and you may want to comment back or provide extra clarification. For hot topics, be ready to answer media questions, given that there are journalists who follow this particular blog. And if you have the energy after writing a blog for Public Health Expert, you could expand your article and potentially submit it to a journal such as a viewpoint piece in the New Zealand Medical Journal. So some final points. Thanks for considering this information. We look forward to seeing any submissions that you'd like to write on public health topics. And as in the slide, here are the contact emails for the editorial team. And if one of your topics relates to those interest areas, please email that specific member of the editorial team. So thanks again for listening, and we look forward to your submission.